Greetings. My name is LaVonne Ansari, and I'm the CEO of the Community Health Center of Buffalo. Today, we're going to really talk about um, the history of the Community Health Center of Buffalo with some of my friends and my mentors. I came in 2006, and I'm going to begin by starting with Gina. Gina,
Okay.
tell us your full name and what you're doing here at the Health Center.
My name is Eugenia Hines. Everybody calls me Gina. I work in medical records and referral department. I came on in 2005. I started off in medical records, worked my way to unit clerk, and Dr. A seen something in me that I didn't see in myself, and she made me a manager of the department. Is that enough?
Sure, yeah.
Oh, I'm good.
We'll go with Doris.
Okay, my name is Doris Daniels. I started at the Community Health Center in December of 1999. I believe the center started in June of 99, so I came 6 months later. I started as a billing clerk, then went from a billing clerk to billing supervisor. And as Gina said, Dr. Ansari saw something in me and moved me up to purchasing officer. I'm glad she did. I really enjoy my job.
And telling everybody else what to buy and what not to buy. Janet.
My name is Janet Jackson, and I started in family medicine at ECMC in 1994. And I started as in the medical records department. I didn't even have a desk. And then I moved to registration. And then Dr. Thompson, who was the medical director at the time, thought about us having our own clinic. And that's how Community Health Center started on Grider Street. And we were right at the corner of the facility. And I started doing registration. And then we had a dental department. And I did registration for medical and dental. Then Dr. Ansari came on board. And she said, we should have our own community health center. And we built this location over here. And I've been here ever since. I really love the people I work with.
Yeah.
That's probably why I've been here so many years. I enjoy the people. It's they're dedicated. I think we have some really good employees, and I've always enjoyed working here. That's why I've been here so long, and I hope I'll be here for another 26 years.
Yeah,
That's right.
I'm looking forward to that.
Yeah.
One of the
Yes.
conversations that I love to talk about is the fact that where we started.
Mhm.
We started with one site. We're now with 4 sites,
Mhm.
20,000 plus patients, 60 something thousand visits. And it was these ladies that's been there since the beginning. So tell us a little bit about that experience of watching it grow and helping us grow as an entity in these communities and the services that we offer. Tell us some of that, your personal experiences of us growing to where we are.
Well, I can say I've seen them come and go. That's for sure. We've had as low as 20 people working for the health center. Now it's over 100 people working for the health center. So like I said, I've seen everybody come and go. It's like a family, and I really enjoy working here.
Yes, when we first started out, we had a medical facility, and then we had dental. And then when dental came, it was excellent because it's like one stop shopping. And then we had a pharmacy right on site, and people could get their medications, the medical, dental. And then we grew when we came over here. We have physical therapy, we have dental, medical, pharmacy, we have
Behavioral health.
yes,
Behavioral health.
And we got peds.
and we have pediatrics
Yeah.
and medical. So we've grown. It's been an adventure, and I have to say I'm glad I've been a part of it because I've had so many family members that come here
Yeah.
and that have grown with
the
the facility
Yes.
and that still come here and their children come here.
Right.
And I've had grandchildren that have came here. So I've grown and my family has grown with the facility, and it's been a great experience for me. Thank you so much, Dr. Ansari.
Well, it's not me. It's
Well, I
you
mean,
all.
for being the CEO that you are, and to let us experience different departments and grow in different departments and learn different and new ideas. And we're a part of that. And I think that's just great because other places, they don't give you that opportunity like you have here.
Well, I appreciate that, but I know that this work doesn't get done by one individual. It gets done by a collective, and all of us have a passion. These team of ladies are my mentors, as much as they don't think that. But if it wasn't for them, they're the shoulders that I stand on, because it's because of their endurance, and all of us have had family tragedies within that have changed some of our experiences, but we have not stopped giving to each other and stopped giving to this community. So that's why I look at these ladies as the historians, because a lot of times their voices are not heard. They're sort of the silent partners or the silent folks that people don't get to hear how we began. So Gina, talk a little bit about when we were talking about moving here.
Yes.
And how some of us had to really work really hard to get the rest of the staff to believe we were moving.
Right.
Tell about that experience.
Well, they didn't believe we were moving, first of all. Basically, the nursing department. We were all, packing up, moving stuff to storage and things like that. And nursing was still unpacked. So we had to really get them on the ball and start helping them pack their things to get them to move so we could get their equipment and different things like that to the new building. But it did take some convincing. Once they seen we was moving, they got on the ball. So we can get their things over here and get everything situated. And by January the 1st, we was in here working.
Yep.
Because we
That's
moved in
true.
December.
That is
we were
true.
working January the 1st. I'm not saying everything was correct, but
Was
we
it-
could serve the population. We could serve our patients.
Wasn't that a snowstorm?
Yeah, it was.
It was. But we still pulled it off. We was able to get our patients in and serve them. Besides having a new system,
Yeah, we did.
trying to work a
That's
new
true.
electronic system.
Yep.
But we got it done. We got our patients seen, and we worked on our system at the same time.
Yeah, and that only comes from the determination of our team, and they're the foundation. This group right here is the foundation of the health center. While you would think it would be the physicians, those physicians are no longer here. But who is here are these people right here, that this health center is built on. So I just wanted to share their thoughts and their experiences so that they get recognized for being the backbone, not just for this facility, but for the community. Because as Janet was saying, we have generations
Yeah.
that come in here and they remember them.
Yes.
Yeah.
Yes,
They come in looking for them.
That's true.
You're still here,
I mean, they come in looking for the
Yeah.
people that have been here that they are
longest.
familiar with and grew up with. So,
Yeah, my family wants me to make appointments for them,
Oh, yes. Oh, yes.
whatever it might be. Instead of them calling an appointment line, they call me.
right.
And I make sure I get the ball rolling to make sure that they get to see whoever they're going to see at the health center. Even though it's my family, patients always come first at the community health center.
Yes.
I've always said that.
Yeah. So talk a little bit about 462 Grida, where we initially started from.
It had,
No, we actually, excuse me, but we actually started at the old
Geneva B. Scrubs,
building.
yeah. in the
That's where we
back.
started from.
Mhm.
And from that building, we went from, they were redoing the new building on the ECMC campus, the 462 Grider Street. We started at Geneva B. Scruggs building at 563 Kensington, if I'm not mistaken. And yeah, I had an office, a little hole in the wall. There's no doubt about it. And it was a small building. It was definitely a small building, no doubt about it. And I don't. And then the new building that we moved into, it was a big. They fixed it up and everything. We knocked out all the walls and everything, and it was just like a whole new building. It's a shell, and so. It wasn't that much bigger than Scruggs, but the old Scruggs building, but it was a nicer building. And then, as I said, from there, we moved over to this building. 4 floors.
Mhm.
And so you can see we moved on up. Yep, just like the Jeffersons.
Yeah, so the 462 grinder was really an
Mhm.
evolution from Geneva B. Scruggs because when I first came, everybody thought we were Geneva B. Scruggs,
Yes.
but
Mhm.
they had to reconfigure Geneva B. Scruggs for multiple reasons.
Mhm.
And so I see the Community Health Center as the evolution from that experience.
That's
from,
yeah.
And that's where they all started.
Mhm.
Many of them, both of them,
Mhm.
started with Geneva B. Scruggs
The building.
building.
Mhm.
And then we moved into 462.
And it had 2 windows. It had we had 2 registration. We had 3. We had 1 for dental and 2 for registration. And then we had a little nook over here where they could come out and make the appointments. So there was 1, 2, 3, 4 windows.
Which one is this? 462.
462.
Yeah.
And then we had a little waiting room. And then before we had a pharmacy, was there? Before we put the pharmacy over there, there was I was trying to think what was it. We had a little space, but then we put a pharmacy in there. But it was small. When you come in the back, you come around. You had a little nurses station, and then you had all the offices where the doctors would come out, and they come to the nurses station, and people could come around and come up to the front and make an appointment. And we didn't have dental at the time. This was just medical.
Mhm.
And then you had medical
was
records in the
behind
back.
there.
medical
Medical
records.
records was right in the
behind
back
there.
of registration.
Yeah.
And it was an experience. Even to the day when I see people at the store, can you make me an appointment? I said, I don't have a computer on me. No, they even asked me today, can you make me an appointment? I said, you have to call the office. I don't have a computer on me.
Well, that's the beauty of the
Yes.
Community
They
Health
know
Center
you are.
because once people know where we work,
Yes.
Yeah.
Yeah.
we become
Yeah.
an
Yes.
asset
Yes.
for them to get services.
Yes.
So it's very personal. And these ladies taught me what that feels like and what that means to the community is because they always have been committed to making sure that the community got service. So, and I always say it's this team, the rest of us, I don't care how many degrees we have, if these ladies don't get the people in, we are just supporting cast members and we can't see
That's
the
true.
patients.
Yeah.
It's these
Yes.
group right here of ladies that actually get the people in. If they don't get the people in, we can't see them. So they are the rock. So that's why I felt it was very important for us to have their voices. So let me ask this for those employees that did not have the experience that are coming in now. What would you say was some of the longevity as to how you stayed here as long as you have?
Okay, for me, it's the people. We here to serve
Always.
the people first. And I like the work that I do. I like helping people. I've always told people in any job that I was in. But if they put the person first, they'll have longevity here and like what you do.
Yeah. And your
Yes.
fellow
And
employees.
yes,
You have to be able to get along with your fellow employees.
Yes.
Like I said, it's like a family.
Yes, it
Right.
is.
teamwork.
Janet, what would you say? What would you say? How would you say people could survive in the health center as employees? What would be a lesson that I would be able to tell
I
new people?
would say not to take things personal because sometimes with the patients, they think when you're talking to them, it's personal, but you're really talking to help them sometimes, and sometimes they don't understand if you don't have an appointment available or they can't then get in and see the doctor when they. But you don't take it personal. You just have to keep explaining to them what's going on, what availability, and the patient is always right. So sometimes you just have to go along with and listen because sometimes people just want to vent and they want somebody to talk to here, and we're here to listen too. We're here to listen and help, and that's what I say. Just listen to what they're saying, and we can help them and suggest other alternatives. You may not be able to get in today, but you can get in tomorrow, or you may be able to see another doctor. A lot of times people call and they want to have a telehealth visit, but their doctor is not available. So I said, I have another doctor that's in Lockport that can call you, and they can call you tomorrow.
Right.
Because your doctor may be on vacation. So you just have to be mindful when people are calling, and they're always looking for help, and it's our job to help our patients in our community.
Right.
And I think that's the biggest thing. And for us to respect each other and to work as a team like we always have.
So I thank you, ladies. I appreciate you all so much. I'm very grateful to have
Thank you.
had you, and you all teach me a lot, because in order for you to lead, you have to be a good follower. And these are my experts.
Thank you.
Thank you, Dr.
Yes.
Ansari.
So I love you guys to death, and I really appreciate, because you all give me the strength to continue to do what we do to serve this community.